Thank you, everyone, so very much for joining me. My name is Rhonda Kay, and I am your instructor for Pharmacology Part 1. This is class number 1, and we are going to be working out of two particular textbooks. At this point, you should have already received your syllabus for the class as well as your lesson plan. The two books that we will be working out of today include, and I want to show you those books. I'm going to be looking back and forth as I teach this class. It's going to be Pharmacology and Introduction, and it's by Hintner Nagel. I love this piece of material. There's a lot of information in this book, so do be prepared to do a lot of reading at night. And also the second piece of material, or the second publication that we're going to be using, is the Medical Assisting Administrative, Clinical, and Competencies book. And we will be working out of chapters 50 and 51. Now, as far as the pharmacology book and introduction by Hittner Nagel, we will be working out of the first 4 chapters. Today, we will be covering the first 2. All right, and we'll also be talking about chapter 50, as I said, in the medical assistant book. There's going to be 2 parts to the pharmacology class. This will be the first part, and the second part will cover the rest of the material that we're unable to cover in pharmacology part 1, only due to time. So let's go ahead and get started. We are going to be covering several different objectives in this class, because as a healthcare professional, you will be required to have the basic knowledge of the medications. You will also be required to be administering medications, whether you're working in a private doctor's office, working in a medical clinic, or even in a hospital setting. You will be required to know these things and to be able to also patient teach and explain to the patient how to be able to properly take medications and or those patients' family members. So as we navigate into this program, we're going to be working with several different student titles. Your nurse aide, your medical assistant, your practitioner, your nurse, your practical nurse, as well as your student nurses. And so there's going to be a great deal of information that I will cover. And I will also use some fun time in class to make you laugh, tell some stories, so that you will, have an enlightened understanding of the subject matter. Okay, so let's just go ahead and get started. Sometimes I do a little bit of reading from the materials, just an effort to open up the subject matter, and then I'll stop. As an instructor, I do not believe that, reading from the book is the best way to teach the class. However, when I want the students to zone in on particulars that I'm talking about, sometimes I'll go in and start reading a sentence or reading a paragraph just so that I can cut myself off so that I can reintroduce what it is that I'm trying to get you to understand. So let's go ahead and get started. So your role as a medical assistant, you'll be expected to have the basic knowledge of the medications. There's going to be an increasing number of over-the-counter type medications that will also be available with prescriptions. And a lot of times patients that really don't want to fill prescriptions, handwritten prescriptions or electronically produced prescription that the doctor gives them, they'll go to the pharmacy, go to the corner store, Walgreens, CVS, Rite Aid, to pick up medications that are over the counter that do not require a physician's signature for them to be able to pick up. So the over-the-counter medications you do not have to have a prescription. A prescription is a document that is a written order by a physician that allows the pharmacist to dispense medications or drugs to a patient. So as a medical assistant, sometimes you will even assist the physician with writing that prescription. You will never sign it, but you may prepare it for him by writing it out, by putting the date on it, the patient's name, sometimes their address and date of birth, the prescription, the name of the medication, and the directions in which the patient will take the medication. And then you'll prepare all of the details. If there's refills, either you're going to handwrite it, or you're going to electronically produce that particular prescription with the doctor's order and then have it ready on that patient's chart for the doctor to either sign off on it, or he can electronically sign it, and then you can submit it to the pharmacy for the patient to be able to pick up. As a allied healthcare professional, as a nurse, you're going to need to be very attentive to ensure that the physician is aware of all the medications that the patient is also taking. Upon your triage of the patient, when the patient comes into the doctor's office and you are triaging them, honestly, before then, you should have already prepped the patient's chart. You should know exactly what medications the patient is already taking. And then this way, once you get into your triage, your interview with the patient, you can go back over those medications. Listen, even if the patient was in the doctor's office the day before, we need to always review what medications the patient is taking. The reason is because they could have left the office that day and went out and got some over-the-counter medication that they had an allergic reaction to. They could have gone to another doctor's appointment, and that doctor could give them a medication, and maybe they went home and experienced a bad effect, an anaphylactic reaction for that medication. And so therefore, they need to be able to tell you this. Why? So that we don't give it to them again. Because we don't want them to take medications that's going to cause side effects or either, some type of anaphylactic reaction. Okay. As the state that you live in permits, you'll also be asked to give the patient drugs. Okay. Now, in the doctor's office, you will be required many times to administer medications. You'll be administering those medications by mouth. And also, you'll be administering those medications by injections. For those of you that work in 23-hour clinics or the urgent care clinic or either a hospital, you will be required to give medications by IV, intravenously by using an IV pump, or even just giving a regular injection. So, safe and effective drug therapy will require more of you than simply just giving the drug or the prescription to the patient. So you need to make sure that you understand that, while it's your responsibility to make sure that you give that prescription, it's also your responsibility to make sure that the patient understands how to take it. Now, you might think, oh, well, wait a minute. What about the pharmacist? Isn't this the pharmacist's responsibility? It is. And usually, if you've ever filled a prescription at a pharmacy, they don't just give you the medication and let you walk away. Usually when you fill the medication, you'll go to one window to give your information, to pay for it, and then they'll say, okay, I'll see you over here to the next window, where the pharmacist will go ahead and hand you your medication and also ask you if you have any questions about it and explain to you how to use it. So the pharmacist will explain, or the pharmacy tech will explain to the patient as to how they should be taking the medication. Advanced skills that you will want to retain or want to attain are going to be very descriptive in your job responsibilities. Follow your office's policy is what I tell the students all the time. There's a particular procedure that you will follow when you're giving a patient a narcotic. We're going to be talking about what narcotic type medications are. So you need to make sure that we understand what those policies and procedures are, so that we do, there's the light, so that we do the best job that we possibly can in making sure that the patient is medicated properly. Okay, let's talk about drugs and pharmacology. Okay, so a drug is a chemical compound used to prevent, diagnose, or treat a disease or another abnormal condition. The study of drugs is called pharmacology. Okay, and a person that's going to dispense this medication to you is the pharmacist. Okay, included in pharmacology are pharmacognosy. I got tongue-tied. I apologize. Pharmacognosy. Okay. And this is the study of the different characteristics of natural drugs and their sources. Pharmacodynamics. This is the study of what drugs do for the body. And then you have pharmacokinetics. Pharmacokinetics is a study of what the body does to the drug. And then you have pharmacotherapeutics. Pharmacotherapeutics is going to be the study of how the drugs are used to treat a particular disease. And then lastly, we have toxicology. So toxicology is going to be the study of poisons or poisonous effects of drugs. So all of these areas we're going to need to become familiar with. And as I got tongue-tied with pharmacognosy, we're going to have to look that up so that we make sure that we're saying it correctly. Pharmacognosy. As we get used to using some of these verbiages that are long, some of these words we're probably not going to use when we get into the doctor's office, clinic, or even the hospital setting. But it is a really good idea that if we are explaining to the patient that we know better and how to be able to say these words so that the patient understands we know what we're talking about. But also we don't want to use terminologies to the patient that if we don't understand it or if we can't pronounce it, then they're not going to be able to do it, and therefore they're not going to follow the directions. So the study of the characteristics of natural drugs and their sources, something like penicillin. Okay, penicillin comes from a plant. Everybody knows about penicillin. It's a very, very old drug. And so with that, it is a natural drug, and the source is a plant. All right. So let's talk about the sources of drugs. You know, a lot of times when we start to take medications, we either take these medications because they're prescribed or recommended by the doctor and or a family or a friend. Maybe sometimes that patient doesn't have the, monetary resources or financial resources to be able to go to the store and get medication. So they may say, oh, you know, I have a headache. I've had a headache for several days. I don't know what to do about it. And mom says, oh, well, you know, come on over here. I can help you with the headache. I went to the doctor a year ago and these medicines worked for me. So here, take one. You think, oh my God, I'm taking some of my mom's med. Well, if you go to the doctor is probably going to give you a medication that's similar or the same medicine. You say, hey, well, you know what? I have a Celebrex here and it's 10 milligrams or it's 100 milligrams and mom has Celebrex, it's 100 milligrams. What's the difference? Well, it's not a difference, but we need to understand that depending on everything that's going on with that patient, we should not be sharing medications. Once we start talking about narcotics, we're going to talk about why opioids and opioid agreements are very, very important, and why it is that we tell patients not to share their prescription, because if they run out of it, if they lose it or whatever, that opioid agreement, based on that opioid agreement, we will not be able to allow the patient another prescription. So the same thing applies when we're at home. Do we still break the rules? Yeah, we still break the rules. So it's different if we're going to go to the store and have an over-the-counter medication like acetaminophen or some type of Advil or even Tylenol. And you say, oh, well, I have a headache. And mom says, oh, well, you know, let's go to the medicine cabinet. Here's an over-the-counter medication. Let's go ahead and take that. That's different. But when there's a medication that's prescribed by the doctor, we need to make sure that the benefits of that particular medication, the dosage of that particular medication, is compatible with what's going on with that patient. So let's get started with drug sources. All right. So many drugs originate from natural products, if we didn't know that. Many of them, as I said with an example earlier today, penicillin, it comes from a plant. A lot of the hydrocodone, oxycodone, these medications come from morphine and, medications like that. They come from medications that are used as street drugs and that are potentially dangerous to our health and become addictive. So this is the reason why when we have exceeded the, if we have, if we're taking an over-the-counter medication, that medication is not helping, then depending on what's going on with the body, we have to go to the doctor and have the doctor to write a prescription for something stronger than that. Then that's what in the store. Okay, so many of these other drugs originate in a chemical laboratory as chemists seek to improve the existing drugs. So from Tylenol, okay, 500 milligram Tylenol. Now you might see in the store now where they have an extra strength Tylenol. You have your regular Tylenol, then you have your extra strength. So your Tylenol ES, extra strength. Then you have your Tylenol for back pain. You have your Tylenol for migraines. Okay, so once we have this, the body has decided, hey, you know what? My pain exceeds what that particular chemical in that medicine can do. Then, hey, you may go to the store or go to the doctor's office. I'm sorry, and in the doctor's office, the doctor may write you a prescription for something a little bit more advanced than Tylenol, maybe a Tylenol 3, and we're going to talk about what that might mean. But it just means that we have to have a prescription for it, and it's going to come from the same source, but it's going to be a little bit heavier in the dosage, and it's going to make the body, it's going to work on the area of body that we have pain. Okay, so let's talk about those natural products. So the natural products, they originate as substances from natural products, often like plants, okay, animals, minerals, bacteria even, or fungi. Exactly. Let's name those sources again. Most often, drugs originate as substances from natural products like your animals, like your plants, like your bacterias, minerals, and even fungi. Okay, so your and you know what we're going to do here is we're going to go ahead and look up the correct, we're going to go ahead and look up the correct pronunciation for this medication. So I'm going to go ahead and do that for us right quick, because it ties my tongue. And I want to make sure that we stay on our live stream, but let me go ahead and let's get the proper pronunciation for, this particular word. Let's see here. Want to make sure that we're still together. I just put on the video for it because I'm having some difficulty pronouncing. I don't want to take too long on it, but I do want to make sure that we cover, how this word is pronounced. And I apologize for this.
Pharmacognosy. Pharmacognosy.
So pharmacognosy. Let's do that again.
Pharmacognosy. Pharmacognosy.
So pharmacognosy is the correct pronunciation. Pharmacognosy. So a pharmacognosist is a person that works in pharmacology. Okay. So a pharmacologist is a pharmacologist who specializes in the study and the characteristics of drugs and their sources. Pharmacognosy. Let's do that again. We'll do it one more time and we'll be done.
Pharmacognosy.
Pharmacognosy. Pharmacognosy. Pharmacognosy. Pharmacognosy. So a pharmacognosist is a person that's going to study, is a pharmacist that actually studies the characteristics of drugs and the sources. All right, so let's talk about plants for a little bit. For years, we've known about penicillin. So perhaps the oldest source of drugs are the plants. Hundreds and hundreds and hundreds of years, we've used plants from seeds. We've used the the seeds that are in plants, the bulbs, the roots, the stems, the bulbs, the leaves, and other parts of the plant. So there's a couple of examples that we're going to talk about when it comes from plant-derived medications. Digoxin. Digoxin, it comes from a foxglove plant. Digoxin comes from a foxglove plant. Quinine. Quinine, it comes from a cinchona tree bark. Cinchona tree bark, so a tree, okay? And there are countless and countless and countless, many other types of new drugs that are developed from plants on a daily basis. All right. So remember those two. If you outside of your penicillin, you have your digoxin, and then you also have your quinine. Okay, animals are also used as a source of drugs. So there's going to be certain animal substances that have been shown to be able to be compatible with our human physiology. And they are like a snake, for an example. If you've ever known somebody that was bit by a snake and say, "Oh my God, I have to go over and get some snake," because of the fact that this person was bitten by a snake, now they need to be able to go and get snake venom. Just like with COVID-19, people that had COVID, that recovered from COVID, were going into they're using those persons' plasma, and having that intravenously administered to a patient in order that the patient's body builds up antibodies against that particular situation to allow that patient to become better. So with using animals, this is the same thing is done. Okay. Let's talk about a couple of examples. So granular substances such as insulin for your thyroid. Okay. If a person is diabetic and their body is not making the amount of insulin that it needs for the body to be successful, then there's going to be the granular substances that are made from animals. We can also use that insulin base to be able to get the body back where it's supposed to be. All right. And then you have fats and oils such as cod liver oil. Okay. And then you have your enzymes such as your pepsin. And then also your anti-serums, like I was talking about earlier with the COVID-19 and with like snakes that need, venom if a person was bitten by a snake. So you have those anti-serums and anti-toxins for those particular vaccines. All right. Minerals is another one. Mineral sources yield various different types of various substances that are used. They can occur naturally, or they'll be mixed with other substances. Two drugs that are derived from mineral sources are your potassium chloride and also your mineral oil. So as an example for your mineral, potassium chloride and also mineral oil. Then you have your bacteria and your fungi. So these are simple organisms such as the bacteria and fungi are your simple organisms. They produce substances that are used to make certain antibiotics. Okay. Penicillin is one that we talked about. All right. So let's talk about how we chemically develop these natural products. So after your
Pharmacognosy.
after your pharmacognosist has identified the chemical properties of a particular natural product, again, an animal, a plant, minerals, bacteria, or fungi, once that chemical property has been identified, then the professional, the chemist, the pharmacognosist, the pharmacognosist will actually do an investigation that will lead to the chemical duplication or the synthesis, just kind of putting that together, the synthesis of one or more of the drugs based on that person's findings. Okay, some of those drugs are synthesized by strictly chemical methods, and others are duplicated by manipulating a genetic information in a host organism. There are different types of manipulations that can cause a host organism to produce a biological product ordinarily produced only in other organisms. For an example, human insulin, okay, is produced by these means. Also known as recombinant DNA techniques. Recombinant DNA techniques. So basically what this is saying to us is that, let's take a very, very simplified explanation. Let's say that a person that uses drugs, okay? When someone uses drugs and they are then known to be a drug user, or when somebody's an alcoholic and they use a lot of alcohol and they're known to be an alcoholic, they don't know when to stop, okay? So when these chemical developments of natural products are investigated by the pharmacist or the pharmacognosist, and they study the sources of the chemical, once that source is understood through the chemical makeup of that drug, and we understand this is exactly the amount that the patient needs to take to feel better. And here's going to be another amount for a patient that is in this situation, and another. Okay. We are able to put those in writing where the doctor can then determine exactly, based on that pharmacognosist research, how much of a milligram that patient really needs in order to feel better. What's going to help their situation? But a drug person, somebody that's using drugs, they don't know what that is. They just want the absolute high. So they'll take medications over and beyond what is necessary. And sometimes this is what leads to a drug overdose. Even when your pharmacognostists, let's look at that one more time. It always ties my tongue. I'm so sorry.
Pharmacognosy.
Even when the pharmacognosist has determined the chemicals necessary for this particular drug, we cannot move on with distribution without the approval of the FDA, the Food and Drug Administration. Once the pharmacognosist believes that they have a drug that will be useful, then they approach a drug company for further research and development, which is controlled by this FDA, which is the Food and Drug Administration. And once the Food and Drug Administration and all the research and everybody involved has gotten together and given the thumbs up, then and only then can the medication be distributed. Now, you will find corner stores that are natural medications or natural drug stores. And if you have to pay close attention to those medications, because it'll say not approved, or it's not past the FDA. It is not past the approval of the Food and Drug Administration. So the FDA is an agency of the Department of Health and Human Services, and it regulates the manufacture and distribution of every drug used in the United States. So the developmental process, in the developmental process, the chemical formula has been identified and the chemical name has been given to that particular drug. Now, that's just like with anything else. That chemical name could be really expensive. Let's call it Neiman Marcus, okay? But then we can turn around and find something very, very similar to that particular drug, and we're going to call that the generic. So the chemical name is going to be that brand, whereas the generic is going to be a step down. All right. So the FDA requires that the drug manufacturers perform clinical tests on the new drugs before those drugs can be used by humans. All right. Those are going to be toxicity tests that are done in laboratories. And these testings that are done in laboratories are usually done on animals, okay? And sometimes they'll have placebos that they'll give to humans as well, to be able to see if this drug is safe, if the effectiveness of the drug is if the, once the pharmacognostic, let's look at it again. Once the
Pharmacognosy.
the pharmacognosist has researched it and they feel like the chemicals that they've put together, or if they've researched, is good enough for, let's just say, 10 milligrams, 20 milligrams, 50 milligrams, so on and so forth, then that information is then followed up with the FDA, and they have their own researchers that's going to look into if they feel like what the chemist has done is factual. Okay. There's going to be particular chemical tests that are designated and designed to consider the ratio of the benefits of the risks or adverse effects. So there's going to be pros and cons. There's going to be pros and cons with everything. There's pros and cons to bread that you eat. Okay. So they have to be able to make that up so that they could list on there the side effects of potentially taking the medications, and then the benefits is what they will learn, from the doctor or the nurse that, the nurse should be explaining this, but the doctor will let them know about the pros and the cons. But all of that is going to be information that's also should be explained by the pharmacist. And then further, there's a package insert that will be explained. Okay, let's move on to pharmacodynamics. This is the study of what the drug does to the body. That is the mechanical action, or how the drug works to produce a therapeutic effect. When we don't feel good, we are looking for that therapeutic effect. We're looking for an effect that will that'll take us from where we are to take us to feeling better. Okay. And so pharmacodynamics includes the interaction between the drug and the target cells or the tissues in the body, and the body's response to that particular interaction. An example, if you have a patient with diabetes that patient is taking insulin, okay, the drug acts as allowing the movement of the glucose across the cell membranes. That movement will allow the glucose availability to the cells to use that as an energy source. All right. The end effect is that it will decrease the blood glucose levels. If that person's blood glucose is way, way too high, the doctor's going to give them that medication either by mouth or by injection in order to take it down. So those target cells will assist with that medicine doing just that. So pharmacokinetics. Pharmacokinetics is what the body does to a drug. This is how the body is actually going to absorb the drug, metabolize it, distribute it, and excrete it from the body when we're all done, when we're good. All right. It's very important that we understand that process so that we'll be able to explain that to the patient, and the results that they get from the medication is what the doctor expects. All right. Now, in the pharmacokinetics, in what the body does to the drug, let's talk about those different areas, how it absorbs it, how it metabolizes it, how it distributes it, and how it excretes it from the body. So let's talk about absorption. So this is going to be a process that converts the drug from its dose form, such as a tablet or a capsule, into the form that the body can use. It's not going to float through the body as that pill that you just take. It's going to be broken down. All right. Um, Tablets or capsules are absorbed through the stomach or the intestines and then into the bloodstream. Water, food, or other particles may either hinder or assist the absorption of that particular drug through the stomach or the intestines. All right. Some drugs might even irritate those particular anatomies of the body as they navigate and travel, journey through it. The digestive organs might feel a little irritated if you just take the medication without having any food. Or, I've seen several different people just take the pill, pop it in their mouth, and just swallow it using their saliva. Well, we have to either take the medications with water or food so that it can so it does not upset the stomach, and so that the absorption process will happen the way that it's supposed to. Okay. Because of the potential possibility of being irritated or being of that absorption process being interrupted, the patient has to follow follow your instructions that you've given to them. Drink plenty of water, or have it with food, and or maybe without food. Okay. Sometimes if the medication calls for the patient to take the medication without having food, they need to do just that. Because if they take it with food, then that's going to be opposite of what we explained to them. So that may cause some undesired reaction, and the absorption process may not allow the medication to do to the body what it's supposed to do. Will it still work? Yeah, it'll still work, but maybe not the way that we wanted it to work. Injected drugs. So if the drug is injected drugs are absorbed through the skin. Okay. Through the tissue just beneath. If it's intradermally, it's in the tissue. Okay. If it's subcutaneously, it's more than likely through the fat. If it's intramuscularly, it's going to be in the muscle. And depending on that particular injection, if it's supposed to be given intravenously, then it is going to be through the bloodstream. Okay, so the absorption allows the drug to enter the blood. The absorption allows for this particular drug to pass through the bloodstream. Okay, and then pass into the tissues. Drugs that are administered IV, okay, are directly available to target the cells from the bloodstream. Okay. The extent and the rate of that drug absorption will be dependent on several different factors. And one of those factors is the route of the particular medication, the route. How am I giving it? All right. Am I giving it by mouth? Am I giving it by injection? Am I giving it, is it a cream that I have to put on my skin? Is it a mist? Is it a spray? Those types of situations. So when drugs are administered by mouth, the coating on the tablet or the capsule, and the amount of the type of food that is consumed with that drug, it might have a direct effect on how that medication is absorbed. All right. Other factors will involve different particular characteristics of the drug itself. All right, let's talk about how drugs are metabolized into our system under this pharmacokinetics. So drug metabolism is the process by which the drug molecules are transformed into simpler products called metabolites. When drugs are transformed into simpler products called metabolites. That transformation will happen in particular areas of your body, specifically the liver. Okay. And in the liver, we understand that in the liver is not just responsible for detoxing the bloodstream. It is also responsible for breaking down different nutrients so that our body can be properly, so we have the proper vitamins and minerals and so on. But also when our body breaks down the particular enzymes that we need to break the drug down in the liver as well. Let me say that again. The transformation usually occurs in the liver where the enzymes break down the drug. And some of these drugs metabolize a little bit better in a different area or organ of the body, which is the kidneys. So metabolism can be affected by a person's disease. Metabolism can be affected by the person's age, genetic makeup, characteristics of the drug, and or other factors as well. Okay. Our metabolism changes as we grow older. Our metabolism changes when we have particular diseases and disorders or conditions that affect the body. So the way that you metabolize something may be a little bit different than how your sister or your mom or somebody else metabolizes it. So when the drugs are metabolized in the liver, when drugs metabolized in the liver are prescribed for either children or the elderly, the dose is likely to be a whole lot lower than it is in a younger adult. However, when metabolism in children and the elderly is different from metabolism in other patients, the drug may remain in the body for longer and possibly reach harmful levels, especially if we're not taking it the way that we're supposed to. The same concern will hold true for any patient with any type of issues with the liver, if they already have some problems with their liver and with their liver functions. Okay, now let's talk about distribution. So distribution is the process of transporting a drug from the site that you administered it, such as the muscle or the injection site, to the site of action. All right, distribution pertains to the length of time that the drug takes to achieve a maximum or a peak plasma level. And that is the length of time between dosing and availability in the bloodstream. All right. And then lastly is excretion. I'm sorry. The last part is excretion. So excretion is going to describe the manner in which the drug is eliminated from the body. Most drugs are eliminated from the body in the urine, and drugs also can be excreted from the body in your feces, your saliva, your breast milk, perspiration, bile, exhaled air, lots of different areas. And this is one of the reasons why it's really important. I tell, my young moms and even, all my moms, when, working in obstetrics and gynecology, the importance of not using recreational drugs, specifically marijuana, because whatever you're taking in, you're giving to the baby. All right. So you're passing that through. So we have to really, really be cognizant of that. And that brings us into pharmacotherapeutics. How is this medicine going to help me? So this is the study of how the drug is going to be used to treat this particular disease or disorder or condition that the patient has. And this pharmacotherapeutics is also known as clinical pharmacology. Pharmacotherapeutics is also known as clinical pharmacology. Let's talk about these generics and brand names and stuff like that. Drug names are very, very important, and I really recommend that you guys Go to Amazon and type in PDR, physician's desk reference. I don't care if it's a 2010 or a 2015, but make sure that you go get you one. If you get yourself one, then you'll have all of the different details that will assist you with learning about, especially older drugs. So let's talk about these drugs names. One drug may have several names, okay, including the drug's official name, which is going to be the generic name. The drug's official name is going to be its generic name. International non-proprietary name, chemical name, and trade name. The trade name is going to be known as the brand or proprietary name of that particular medication. To demonstrate the trade name, antibacterial drug prescribed by physicians as Keflex or Biosef is also identified by the following names: Cephalexin. So Cephalexin is an antibiotic and it is a generic name. All right. Whereas, Cephalexin is the generic name, where Cephalexin is the international non-proprietary name. So it sounds really, really similar. And then you have your chemical name. So the chemical name is some type, probably several vowel sounds and, all these letters. That's generally going to be your chemical name. And you're not going to be giving your chemical name to the patient. You're not going to be writing the chemical name on the prescription. Generally, that's going to be your generic name. It's going to be the generic name that the drug comes in. And then, but it's not going to be the chemical. Okay. So as an allied healthcare professional or as a medical assistant, you'll need to use only the generic or the trade names, which is what I just said. So I'm just looking at this information that's in the book here. Let's move on because I want you guys to do the reading. And let's talk just a little bit here about the drug categories before I change books. And we're going to use the next 30 to 45 minutes of, introduction to pharmacology. All right. So let's talk about the drug categories. So drugs are going to be categorized by its action to the body, this action on the body. Okay. There's going to be a few areas. Its action to the body, the general therapeutic effect, and also the body system affected. The system of the body, I have a headache, so we're talking about the head. So those three areas, categorized by the action of the body, the general therapeutic effect. Oh, it took my headache away, but it made me feel kind of drowsy. I felt kind of tired, and then the body system affected, the nervous system, the brain. Okay. Or, the nervous system, the brain. All right. So, it is very important that if you are studying the material, any areas in the book that are like the tables or it's referring you to a particular area, I would like for you to study those areas. Okay. So when we're talking about commonly dispensed drugs right here in America, we should be looking at three different areas. And those three different areas are going to be your category of the pharmacologic activity, the trade name, and then the generic name. So your category of pharmacologic activity, the trade name, and also the generic name. All right. And there's lots of different drugs. And let me just talk to you about a couple of few. All right. Let's say the category of a pharmacologic activity. Let's say we all know about antibiotics. So antibiotic would be under that category. All right. What's a trade name for a particular antibiotic? What about zithromycin, Zithromax, penicillin, amoxicillin. All right. That's going to be the trade name. And then under the generic name, let's look at Cipro, for an example. Ciprofloxacin is going to be the generic name, whereas the trade name is Cipro. All right. Let's look at Zithromax. Zithromax is going to be the trade name, whereas azithromycin is going to be the generic name. Let's look at another category. All right, let's change the category from antibiotics to perhaps antifungal. All right, let's look at an antifungal drug. We all know about diflucan. Everybody was happy when diflucan came out because women that were prone to have yeast infections would go to the store and get over-the-counter Monistat. You say, oh, I have a yeast infection, so I have to put this suppository in the vaginal area for 7 days. And then they went to having a 3-day. And now they have a by-mouth medication that's been around for a lot of years, which is an antifungal, and it's called diflucan because that is yeast. Okay, so that yeast is a part of the under that category under antifungals. So the trade name is diflucan, and the generic name is fluconazole. Fluconazole. All right, let's go over one more. Let's talk about a different category of medication. Let's look at NSAIDs. NSAID, NSAIDs. Okay. Some of the NSAIDs that we're really familiar with. Prescription, Celebrex. Celebrex is going to be your trade name, whereas your generic name is Celecoxib. Celecoxib. So we're probably not going to be writing down Celecoxib on the prescription pad. We are definitely going to be writing down the trade name, which is Celebrex. So you're going to do this 50 zillion times before and you may say, oh my God, do I have to know all that up front? No, because depending on what office that you go work in, you're going to be using common drugs that you're going to see all the time, day after day after day after day, and they're going to help you to remember it. Okay, so please don't be worried. I want to give you a couple of different. Let's go over a couple of more. Let's go over a couple more of the drug categories. Anybody want to come up with one? I've given you several. We had antibiotics. We already did antibiotics. Let's go on. Let's do anti-inflammatories. Okay, an anti-inflammatory, which is there's two types of anti-inflammatories, which is your non-steroidal NSAIDs, and then you have your steroids. Okay, so your in the drug category of an anti-inflammatory, at least the NSAID, your ibuprofen, your Advil, your Celebrex, your Medrol, your prednisone. Okay, what does this particular drug do? What's the action? Well, it reduces inflammation. That is the drug category, the generic name, and the drug category, the generic name, and the action of the drug. Okay, so you do have several different categories of pharmacologic activity, and then you have your drug categories, your generic and trade names, and then the action as to what those drugs will do. All right. Okay, so let's go ahead. We talked about antifungal earlier today, and we talked about the diflucan, which is the fluconazole. It kills or inhibits the growth of fungi. So for whatever reason, yeast falls up under that, and that's why a lot of women or the doctor's offices may prescribe diflucan for patients that are having some problems with fungi or yeast. Okay. One of the ones that we will see, one of the types of issues, conditions, disease and disorders that we'll see commonly in the doctor's office is hypertension, high blood pressure. Okay, so under that drug category, it is going to be anti-hypertensive. And there's lots of anti-hypertensive type medications. One of the most common ones is your amlodipine. So amlodipine is a generic name. But the trade name for that is your Norvasc. You'll see it all the time in the doctor's office. It's going to reduce the patient's blood pressure. Okay? All right, so that's enough of that. I really want you guys to make sure that you look over those drug categories, generic names, actions of the drug. And now it brings me to talk to you about the indications and labels. This is very important. Do you read them when you go home? As yourself, as a studying allied health student or studying nursing student, do you read them? Well, I would probably say that a good bit of us don't read it. Okay? Statistics show that when a doctor writes a prescription, 1 in 5 prescriptions that are out of 5 prescriptions that are written, 3 patients will fill them. And of those 3 patients, 1 take them. So this tells us that there's a huge problem with compliance. If we can't get our patients to be compliant, then they're going to come back with a higher blood pressure. And the next time that they come back with a higher blood pressure, we're going to be looking at a patient that potentially is in a position to have a stroke. So we want to make sure that compliance is compliance is what the patient is in line to do. All right. Does that mean that they're going to read the indication levels? They're going to read the indications and labeling? Does that mean that that's going to happen? Probably not, especially if you're not even doing it. However, when that prescription is given to the patient in the doctor's office, it is your responsibility to make sure that we patient teach. We need to at least explain to them, just in case the pharmacist doesn't, when they give that medication to them, because they're asking them, do you have any questions or concerns? All right. But we need to make sure that when we're patient teaching, we let them know there's indications and there's labelings. There's a package insert that's within that's with the medication, and you should read it. First off, the writing on it is teeny, 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 tiny. But this does not mean that we should not still take it upon ourselves to write it because we should, or to read it because we should. And indication is the purpose or reason for using that particular drug. So obviously we know how important that is. The FDA approved indications are a part of the drug's labeling. Okay, so labeling also includes the form of the drug, such as it's a tablet or it's a liquid. Okay, in the labeling, we're going to be able to understand what type of form this medication comes in. Is it injectable? Is it a liquid? Is it a by-mouth medication? Is it a spray? Is it a suppository? Is it a cream? Okay. And this is all going to be found in the labeling. However, in the indication, it's going to talk to us about the purpose of the patient taking it, why it's important for them to take it, and what's going to happen. So regardless of the category, some drugs might be used to treat several different types of conditions. Okay. Multiple uses are possible if the drug affects several body systems at one time or at once, or if the drug's primary effects produces a significant secondary effect in other systems of the body. So this simply means that when a drug is used for multiple indications, for multiple purposes, okay, one or more indications may not be in the labeling, may not be in its labeling. All right. So out of label prescribing is absolutely illegal here in the United States. Out of label prescribing is illegal. Doctors who do not know from continuing education seminars and any other programs that they've taken, that such uses are generally accepted. For example, Benadryl. Benadryl is going to be your generic name, whereas your trade name, or vice versa, I'm sorry, Benadryl is a generic name, and the trade name is going to be a really long name. And let me pronounce this one for you. Diphenhydramine. Diphenhydramine. Diphenhydramine is Benadryl. All right. So it is an antihistamine and it's used to treat allergy symptoms in both children and adults. But because it tends to make the patient sleepy, but it's safe for children, a pediatrician may use a lower dose of this Benadryl as a temporary sedative for a young child, but use it as a sedative. However, it is not a part of the labeling of Benadryl to use it as a sedative. We just know that it's going to make the patient really sleepy. So we're going to tell mom and dad, all right, so when they start having these issues, go ahead and give them this amount of Benadryl. And you might want to go ahead and give it to them at night. That way, it's going to be a 24-hour effect. They're going to sleep through the night. You're going to be able to rest. You're not going to have this runny nose and itchy eyes and itchy throat and all this stuff. And it's going to take them through the next day. So when they do have to go outside, they won't experience some of the symptoms that they're experiencing. Okay, let's go ahead and move on to safety and the effectiveness of the drug. So the safety of a drug is determined by how many and what kinds of adverse side effects that are associated with that particular drug. Okay, an adverse side effect may require immediate attention. Okay, it's very important that when you triage your patient, you are asking them about the medications that they're taking, and you're also asking them if they have any allergies to drugs and medications at all, because we want to list those in the patient's record. Okay, so an adverse side effects is going to be a little bit different than an anaphylactic reaction, and we're going to talk about those. So even though an adverse effect may require immediate attention, it's not uncommon for the patient to call a doctor's office with a complaint about a new symptom after they've begun a particular drug therapy. They may say, you know what, it really, really made me itch. Or I had insomnia. I was not able to sleep when I took this medication. The first time I took it, I didn't feel like that. Or the second time I took it, I just noticed that it made, I didn't know if that made my stomach hurt, or if it was that I just didn't get enough to eat that day. Okay. So then I took it for 2 more days and I noticed the same thing happened. And so I'm thinking that this is the medication. Okay. So that's going to be known as an adverse effect. Okay. What we have to do is we have to make sure that we are being alert for such complications, because they could be the sign of an adverse reaction of the drug, or even an interaction with another drug or medication. So it's very important that we understand that. We also need to understand that some adverse effects are common, whereas others are very, very rare. Okay, let's just talk about the effectiveness of these medications. And we are going to talk about the difference between, when it comes to safety, we're going to talk about the difference between an adverse effect and an anaphylactic reaction. All right. Give me 1 second, you guys. I'm not sure if I can pause this or what, but I don't think that we can. So we'll just go right on, and I will return my call in just a quick moment. But because we're live right now and I don't want to interrupt the live, so I'm going to call back my caller in just a second. But I want to talk to you about the effectiveness of the drugs. All right. So a patient might complain about a newly prescribed medication not doing what the doctor said it's going to do. Okay. Sometimes it's because our patient is not giving it enough time. Sometimes it's because particular medications that we take is time released into the bloodstream, and it's going to take 1 day or 2 days or 7 days for it to really get the maximum effect that the patient is looking for. All right. So sometimes when you have your patients that come in, they're really sick, and we give them an antibiotic, we give them some cold medication, and the next day it's not working. Well, we truly have to make sure that the patient is giving the medication enough time to take effect. All right. So a patient, there's a variety of different examples and explanations for these complaints. And here are a couple that we will go ahead and talk about. The medicine is not working. The medication is not working adequately, or I don't know how to use the medication. The dosage, okay? I think the dose needs to be increased or adjusted, okay? The drug doesn't seem to have reached the therapeutic level in the bloodstream. In other words, it's just not working. I've taken it and I still feel the same. The wrong drug was prescribed, or the wrong drug was dispensed by the pharmacy. It's rare, but it's certainly possible. Some drugs work better in some patients than other patients, and not every drug is for everybody. All right. So there's lots of different situations that might make the efficacy or the efficacy of the drug great, a good idea for that patient or not. So also there's different types of therapies. There's different types of drug therapies. All right. So depending on the patient's condition, the doctor might use a particular drug that will work for a patient that may be having an acute situation. Okay. If the patient is having an acute situation, the drug is going to be prescribed to improve a life-threatening or a serious condition such as epinephrine or some type of severe allergic reaction. All right. Maintenance could be another one. Prophylactic, replacement, supportive, and supplemental. I want you to look at all the different types of therapies that drugs are used for. Okay. Toxicology, generally, if the doctor is ordering some type of toxicology study, he might be wanting to find out if, if the patient is using street drugs or drugs that are not prescribed, or if the patient has been poisoned, to see the amount of drugs that's in that patient's system. So by definition, pharmacology is a study of poisonous effects or the toxicity of drugs. The toxicity of the drugs, including drug adverse effects and drug interactions. Okay. In your PDR, your physician's desk reference, you will find all of this information. And you will also be able to find some drug sources of drug information. So it's very, very important to keep up with the source of drug information when you are in the doctor's office or the clinic or anywhere else, so that you understand exactly what you are or what the doctor is prescribing to the patient, so that you as the nurse or allied health professional is able to patient teach a little bit better and make the patient understand exactly all the details about the medication. All right. I'd like to make sure that you guys, I'm going to go over one more area before we actually get into the actual pharmacology introduction book. And then we are going to pick back up on tomorrow, and I'm going to lecture the last 2 chapters, but I want you guys to do the reading. Now, let's talk about narcotics and opioids. Okay. Opioids are natural or synthetic drugs that produce an opioid-like effect, like codeine, morphine, Demerol, and government agencies use popular drug terms called narcotics. So when we hear that, we think, oh my God, drugs, somebody's doing something that's bad. All right. So in the healthcare profession and professionally, we still use the word narcotic. If the patient is taking a narcotic type drug, first off, they have to have a prescription for it. Secondly, it cannot be called in. And thirdly, they have to have the prescription to introduce to the pharmacy to have that particular medication filled. All right. So drugs are going to be categorized by schedules depending on the effectiveness or the potential chance for that drug to be addictive. All right. So drugs are classified in different schedules. All right. So first off, what we need to understand is that there's a comprehensive drug abuse prevention and control act known as the Controlled Substances Act, CSA, of 1970, here established in the United States of America. It is a federal law that created the Drug Enforcement Administration, which is the DEA, and it strengthens drug enforcement authority. So the CSA, which is, again, this Controlled Substances Act, it designates 5 different schedules according to the degree of potential for a substance to be abused, as I was saying earlier, or used for a non-therapeutic effect. All right. There's 5 schedules, and we're going to talk about all 5 of them before we leave out today. So we'll be done in about 30 minutes. Drugs that are Schedule I substance, these have a high abuse potential or pose unacceptable dangers. Let me read that for you again. Schedule 1 out of 5. These are substances or drugs that have a high abuse potential or pose unacceptable dangers. We do not want to be affiliated with using Schedule I drugs illegally. However, if you have a prescription for a narcotic type drug, morphine, it's okay. You can take it to the pharmacy and have it filled. All right. Morphine is a drug that has a high potential of abuse, and it can be addicting. All right. So that's your Schedule I. Schedule 2. Your Schedule 2 drugs have a high potential for abuse and may cause physical or psychological dependency. They do have a therapeutic use, however, for which they do have, there's a written prescription. You have to have a written prescription. Now, let me go back to Schedule 1 for just a quick second so I can give you a few examples, which I did already. But it's like heroin, LSD, like a street drug. Heroin is a street drug. LSD is a street drug. Marijuana has become legalized in many parts of our country and also in other countries. Okay. So can you get a prescription for marijuana? Yes, in some states. In Georgia, as where we are right now, it is still not considered a legal recreational drug. I believe it is legal for medical use, but not for recreational use. So that is under Schedule 1. Schedule 2 is going to be more like I said morphine earlier, and I apologize. Let's put that under Schedule 2. Your morphines, your Demerol, these are drugs that are going to be known as like your opioids. When the doctor's office is giving a patient an opioid, you will have an opioid agreement, especially if it is a pain management office. Now, if it's a regular internal medicine or family or general, they may once write you a medication for something maybe like, I don't see too many offices at all writing Schedule 2 drugs under, Let's take me for an example. I had meningitis several years back, and the specialty of medicine that I was seeing is called disease. Anyway, it seemed very different than OBGYN, pediatrics, internal medicine. Okay, so the doctor that I was seeing prescribed me morphine, and I had a time just trying to fill the prescription. Excuse me, I believe I was told there was only a couple of different pharmacies that would fill the prescription. And finally, I was able to, just said, forget it one day. And I just went to CVS, and CVS was like, oh, sure, we'll fill it. But Walmart wouldn't fill it, couldn't fill it. They said that they didn't, because of the type of medicine that it was. CVS said this, Walgreens said the same thing. Walgreens, but CVS had it. So that is what's going to be considered an opioid. All right. Prescriptions for those particular type drugs cannot be renewed. You're never going to see a narcotic or opioid type medication with refills. There's not going to be any refills. Every time the patient needs another narcotic prescription, they need to come into the office. They need to be evaluated before it could be refilled. Can I call and get them to refill it? No. Not antibiotics, not narcotics. It's not going to happen. Patient needs to come in. Schedule 3. These are lower abuse potentials than other drugs than that of Schedule 1 and Schedule 2. Okay. Schedule 3 drugs, some of the drugs belong both to Schedule 1 and 2, depending on the strength per the tablet or the capsule. Let me back up a little bit. So with Schedule 3 drugs, obviously they have a lower potential than 1 and 2. And they may cause a moderate to low physical or psychological dependency. So your prescriptions for these particular drugs may be given orally or given in writing. So we could call into the pharmacy with Schedule 3, or we can write out a prescription and give it to the patient. We can include refills on those, and we can write prescriptions for refills up for 6 months. Okay, so let's let's talk about the different types of medications. Okay, so let's take me for an example again. I suffered from migraines, and I was so tired of suffering from migraines, so tired of taking NSAIDs. All right, but I didn't want to take a narcotic. So instead of going to pain management, I went to my regular internal medicine doctor, and he gave me butalbital, which is basically like Tylenol 3. So remember I told you when we first started talking today that I was going to give you an example of if the Tylenol in the store, extra strength, migraine, back pain, whatever. The chemist, the pharmacist that studies the natural sources of the medication, okay, that put that chemical makeup of regular Tylenol, migraine Tylenol, back pain Tylenol. If the patient has exceeded the effects that can happen for that medication by taking that, then you go get a prescription written for Tylenol 3, which is this butalbital. And that is an example of a Schedule 3 drug. Okay. All right. So now we're talking about Schedule 4. So obviously it's a little lower. It's a lower abuse for potential than do other drugs. And we can write refills for those. They could be called in, they could be handwritten, they could be electronically done. And an example of that particular type of medication, Valium. Okay. A lot of patients that, have some anxiety issues if they're going to have surgery, or they have anxiety issues after work, and maybe the job is stressful, their home life is stressful. Doctor may write them something like Valium to take at home, or lorazepam, and this is going to be considered a Schedule 4 type drug. And then you have your Schedule 5. So it has a lower abuse potential than any of the other 4 that we talked about. Most of the Schedule 5 drugs can be dispensed without a prescription, depending on the state regulations. Most of the drugs are anti-diarrheal type drugs, or anti-tussive type drugs for cough, that may contain very, very small amounts of codeine in it. For an example, if you're sick and you go to the store and you get Vicks, okay, the liquid Vicks to take for your cold. Okay, so there's a little bit of a opioid type medication in it, like a codeine or one of those. Okay, so sometimes the Drug Enforcement Administration will reclassify drugs. For example, a drug that is addictive than originally determined, and therefore it has to have the class reclassed. I think some years ago, tramadol and toradol were not considered narcotic or opioid type medications. And I believe over the last several years, tramadol and or toradol have been put on the list of Schedule 2 or 3 drugs, maybe Schedule 3. Okay, but they're no longer a Schedule 5 type drug. Okay. All right. Well, I really want you guys to continue to do your reading and your research on Schedule 1 through 5 drugs. I want to talk just really quickly here about some of the key terms that are in Chapter 1 as well as in Chapter 2. We've already covered, a good bit of the drug sources and what have you. But I do want to go over a little bit of that information. In fact, I won't even go over the key terms. You can go over the key terms yourself. You can go over the drug sources. We've already covered those. But what I do want to talk about is your basic concepts of pharmacology, because I think it's very important that you understand your basic concepts. So let's talk about those. So, like with anything else, fundamental principles and concepts will form the basis upon which additional information can be added. Pharmacology is one of those subjects, okay? Pharmacology is not an exception to the rule. Let's talk about the site of the action of medication is very important. The mechanism of the action is very important. The site, the receptor site, as well as the antagonist and the agonist. Okay, you should have learned about your antagonist and your agonist when you study anatomy and physiology, the muscle part of the anatomy and physiology. Okay, all right, so let's talk about the site of the action. Okay, the site of the action is the location within the body where the drug exerts its therapeutic effect. The site of the action of some drugs are not known, okay? However, the site of the action for most drugs has been determined, and that's why we give you those categories, all right? Let's talk about it. So, aspirin, for an example. Aspirin is going to alter the activity of the hypothalamus, which is one of your endocrine glands, so that the body's temperature is reduced. All right. So this is the site of the action, which makes it very, very important for you to understand that. The mechanism The mechanism, I'm getting a lot of messages from students right now, so I apologize to hear it going. And this is my first class that I'm doing with pharmacology on this portal. I've done a couple of classes already before, so you have to just kind of give me a little bit. It's going to get better. It's going to get better. We'll have so many interruptions. And I really want to make sure that I don't want to be on here more than an hour and a half or an hour to an hour and a half, because I think that more time than that really kind of makes things a little complicated. So the mechanism of action, this is going to explain how the drug produces its effect. So in order for the nerve impulses to be conducted, sodium ions must pass through the nerve membrane. In order for this medication to do what it's supposed to do, okay, then we're going to have the sodium ions. They're going to need to do what they're supposed to do so that we have enough action potential for the drug effectiveness to begin the process. Okay, let's talk about the receptor site. The drug action is usually thought to begin after the drug has attached itself to some of the cell membrane. All right. For a few drugs and for normal body substances, there seems to be a specific location for particular and for certain cells. This particular area is going to be referred to as the receptor site. So the attachment or the binding of that drug to a particular receptor cell begins a series of cell changes referred to as the drug's action. Okay, this leads us into the antagonist. What's going to actually make it happen? So let me just give you a little bit of example as to what I just said. So when a particular receptor site for a drug is known, the receptor site becomes the site of the action for that particular drug all the time. Unless something malfunctions with the body or unless something happens with the body, that will change. Otherwise, we already know that's going to be the designated place. All right. Morphine, for an example, that's an analgesic drug. And it's an example of a drug that's thought to bind to specific receptors. All right. So the receptors for morphine are located in the brain, and they're known as the morphine or the opioid receptors. So when the morphine goes to bind itself to the receptor, it produces the cell changes that reduces that perception of the pain that the patient is feeling. And so therefore the effectiveness of it is like, I took the morphine. Okay, I feel a little bit woozy, but the pain is gone. Oh, wow. Because there's a specific site that it'll actually go to and just attach itself so that effectiveness can work. Okay, so there are many different pharmacological receptors. All right. And they'll be explained as we navigate this class. So in terms of your agonist and your antagonist, if you don't remember what they are, then I would recommend that you open up your anatomy and physiology books to your muscular chapter, the muscular system, and just kind of look over that again so you just kind of refresh your memory. All right. So drugs that bind to specific receptors and they produce a drug reaction are called agonists. Let's say that again. Drugs that bind to specific receptors and they produce a drug reaction is the agonist. Have you ever had somebody that just antagonized you? Well, that's the antagonist, but anyways, you have to get the agonist first. You have to be annoyed. Okay, so something is going to annoy a situation. If somebody is doing something and you don't like what they're doing, then you can get something to go and annoy them and make it stop. And then the antagonist will antagonize them so much to where it's just not going to start again until I send the antagonist back once they stop. Okay. So So drugs that bind it to a specific receptor to produce a drug reaction is the agonist. Morphine is an example of an agonist. Why? Because morphine attaches itself to a particular receptor site or receptor cell. All right. So drugs that bind to a specific receptor but don't produce any drug actions is the antagonist. There's no reason for you to be here. You're not doing anything but driving me crazy. That's not a good example, but you kind of get it, okay? So a drug that binds itself to a particular receptor, but then there's not going to be any effect. It's not going to produce any type of drug action. That's the antagonist. Antagonist. So antagonists are also known as blocking drugs, which is good. Usually the antagonist will bind to the receptor and prevent another drug or body substance from producing an effect. All right. So morphine, naloxone, naloxone, which is a morphine antagonist, is administered to prevent or antagonize the effects of morphine in cases of morphine overdose. So if a person took some morphine and it was an overdose, and they're going to give this naloxone, which is Naloxone, okay? And that is going to attach itself to a particular site, namely the same ones that morphine will attach itself to. And it won't cause some type of effect on that particular receptor site. None at all. But it'll block it'll block the effects of more morphine, causing the body to continue to take a downward spiral because of the fact that the patient has already taken too much. So it's going to kind of actually reverse it or keep it from getting further into downfall, if that makes any sense. Okay, so there's going to be many examples of pharmacology where drugs antagonists are used to prevent other substances that do exert some type of effect. So what happens when both the agonist and the antagonist drugs are administered together? They will compete with each other for the same receptor site. They're competing with each other. This effect is known as competitive antagonism. Competitive antagonism. In fact, that's going to be your attendance flag word. Competitive antagonism. The amount of drug action produced depends on which drug, the agonist or the antagonist, occupies at the greatest number of receptors. So if they're both competing for that same receptor site, the one that wins is the one that has the most. Okay. And you can look at a couple of different examples that you have here in the book. We've already talked about, drug safety. I do want you to talk about the dose curve, the dose response curve, as well as the time response curve. I want you to read more into adverse effects, which is all in chapter 1. Okay. We are also supposed to talk about chapter 2 and the biological factors affecting the action of drugs. And I will do another recording tomorrow. Okay. So again, your attendance flag word for today is antagonist. I believe I just told you it was antagonist effect. Your attendance flag word for today. Well, you will have heard it. Okay, so I believe it was antagonist effect. But I really appreciate you guys for joining me. And I look forward to seeing you in the next class. Take care and thank you. Bye-bye.